Good afternoon. Welcome to everyone attending today in Mathematica's DC office, and welcome also to those participating via webinar. Before we get started today, please let me remind those of you who are in the DC audience to join us afterward for a networking reception here in the 12th floor lobby. As the director of Mathematica's Center for Improving Research Evidence, it's my pleasure to share a little about the center, CIRE, with you. CIRE is positioned to bridge the gap between policy research and practice by offering a broad array of rigorous scientific research and evaluation approaches applied in a variety of settings. For our discussion today, we'll focus on how administrative data can be better used to improve public child welfare programming. I'm thrilled that we have one of Mathematica's senior fellows, Matt Stagner, as our moderator today for the discussion. With his deep expertise evaluating child welfare programs and policies directed at vulnerable youth, Matt is really an ideal moderator for today's discussion, and we look forward to hearing his remarks as well. In addition to Matt, our distinguished panel of guests today include Brian Lindert, the Senior Director of Quality Management at Eckerd Community Alternatives in Hillsborough, Florida, Jennifer Noyes, who is Associate Director of Programs and Management at the Institute for Research on Poverty, and co-director of the Center on Child Welfare Policy and Practice at the University of Wisconsin-Madison. And then finally, Maria Kanchan, who is Deputy Assistant Secretary for Policy at the Administration for Children and Families at the U.S. Department of Health and Human Services. Please note that we're video recording today's session, so we may capture images of some of you in the audience. This video will be posted to the CIRE website later this week. To help ensure our highest possible sound quality for our webinar participants, we ask that you please silence your electronic devices now. With that, I'll pass it over to Matt Stagner.
Thank you so much, Anne. It's really a pleasure to be here today to moderate this session with old friends and new. I look forward to hearing from the panel of experts and also to hearing their responses to questions that might come from those of you on the web, on the webinar, or here in the audience today. So remember that at the conclusion, we will entertain questions, and we'll ask you to, if you have a question, raise your hand. We'll bring you a microphone if you're here in the audience. And if you could introduce yourself and your organization, that would be great. So now to the topic at hand. So the question, first of all, is why focus now on improving the use of administrative data in child welfare? This is obviously something that's been going on for many years, and we hope will go on for many years into the future. We felt that today, in 2015, was a very good time to have this conversation, though, for a few reasons. The first is the maturing of state SACWIS systems. SACWIS is the acronym for the Federal Investment in Child Welfare Administrative Data Systems. It's been nearly 20 years of investment in those systems. Some states have been through various versions of them. All of them now are at a point where we can really reflect on what are the things that we can capture in these systems and how can we use them for policy and practice. There's also rising awareness that children and families need steady, coordinated support from many systems. The Child Welfare Agency is often our first line of defense, but we know that these children and families are involved in multiple systems. The children are in school. Many families are connected to Medicaid. Many are receiving mental health or substance abuse treatment services. And now is a good time. We've known this for a long time. We have lots of data that tell us this, and it's time to think about how to use that data, those data, the best possible. There also is a focus on interoperability of these multiple systems. This is a phrase that the Administration for Children and Families is using. We might know it as coordinated services. Maria might talk about how it's exactly defined. But given this multiple involvement, how to get all these systems to work together in a coordinated fashion to respond to the needs of children and families is an increasing imperative. We also have better methods for linking data and for analytics. These things, again, have been going on for decades, but we have new improved methods. We have a lot of work going on around predictive analytics in healthcare that could be brought into the child welfare or human services arena. So it's a good time to take stock of, given the data resources and the methodological resources, where could we go with this? We also need to think about many stakeholders. There are the families and children themselves. There are stakeholders at every level of government, and the reason we put the panel together the way we did was to have someone from a local system, someone working closely with the state system, and a representative of the federal system. At each of those levels are, again, the stakeholders from the various systems responding to the needs of families. So all of these things seem to say to us now was a good time to continue and focus this conversation. This next slide shows how we might think of a continuum of uses for administrative data. At the highest level is, and this, I shouldn't have put this at the highest level. I don't mean that it's the highest it's the ideal level. But in the ivory tower, there are academic settings where people are pulling data from these systems and helping to understand the interrelationship of systems, the way families move through these systems. This work is driven by an interest in describing and understanding in the biggest picture, what does this look like? It's not necessarily connected to the day-to-day needs of policymakers or practitioners, but it is informative over the long run in helping them. At the next level down are the needs of those state and local policymakers who often have a research partner where they're together thinking about these data. The questions might be coming not from the research literature, but from the local agencies or the state agencies. An academic partner may be involved in putting the data together, making sure the data are organized the way they need to be, conducting the analysis, and engaging in a conversation with those state and local policymakers. The third level is a little bit different than that. It's not addressing a longer-term policy question, but it's really guiding management and improving the immediate responses of the system. Likewise, there may be an outside partner. This may be going on within an agency or a set of agencies within government. But the aim is to do a better job of predicting service needs and creating incentives for the services to meet the needs of families. So you might think about performance-based contracting as something where we're putting together data resources and challenging a private agency working for a local child welfare organization to meet the needs in a particular way, potentially with contract bonuses or penalties depending upon what the data show. So this is even more real-time, may involve, again, an academic or an outside partnership, but is very focused on the day-to-day, month-to-month management of the system. And then down at the bottom, which probably should be the top in that it's where the most important things happen, is the question of how to use these data in the hands of caseworkers, improving frontline practice. There are vast new opportunities to do that. I think we're at the very beginning of really understanding how, when that would happen, what that would look like, and how practice might be driven. Today we'll be focusing mainly on these middle two parts of the continuum, working in partnership with state government or local government to answer policy questions that are driven by those policymakers, or thinking about the management of a child welfare system by using a broad array of data to understand the needs of families and how best to respond to those. So with that, I'm going to turn the slides over to Brian, who will begin to tell us about some of this use and then we'll put it back in perspective. So, Brian.
Thank you, Matt, for the opportunity, and thank you to Mathematica for allowing us to come to DC and describe the work that we have been doing in Tampa, Florida. I'm going to speak today a little bit about, towards the bottom, or I guess the top, however you want to talk about Matt's Continuum, about guiding frontline practice and the management of our system using data, and I'm going to talk about how we did that by data mining, and we'll be doing that using predictive analytics, using the SACWA system completely. So not necessarily linked data sets, but very granular data that's available in SACWA systems. It's available in Florida's SACWA system, and it's available in 5 states that we're working with right now. A little bit about our organization. If folks are not familiar with Florida's community-based care model, we are essentially a privatized state, Florida and Kansas being the 2 states that are furthest down that road nationally. We've been privatized in Florida for well over 10 years. We operate the child welfare system in the Tampa Bay area, so Hillsborough, Pinellas, and Pasco counties. That's St. Petersburg, Tampa, Clearwater area of Florida. The Tampa system of care has 1,900 children in out-of-home care, to give you a sense of size and context. Our organization really does operate, therefore, in the role of the state. So the Florida Department of Children and Families has a very small number of regional staff who do contracting, quality assurance, some of the traditional roles that the state has done, but everything else has been contracted out to lead agencies in Florida, and we have that role. We had that role for several years in Pasco and Pinellas County, St. Petersburg, Clearwater, but we have only been doing that role in Tampa, the largest part of our business, since July of 2012. One thing that may differentiate us as an organization, and it's probably partly due to the fact that we are a private nonprofit, is that our attention and focus on quality is absolutely demanded by our leadership to be forward-looking. There is no appetite or satisfaction with retrospective review of cases or retrospective reporting of data and outcomes. It does not help a frontline supervisor. It does not help a case manager or a system operator or subcontractor operator for me to tell them how they did on their CFSR outcomes 3 months ago. That's nice information to know, but what they want to know is how they are going to do in the future. And so for that reason, we spend a lot of time focusing on the new entry cohort measures and providing forward-looking dashboards that say, for example, if 100 kids came into care last December, how many have we gotten home today? How many do we need to get home between now and the end of December in order to be a leader on those outcomes? And we also want to provide that same kind of forward-looking data at a client level. And so we'll talk today about a safety example, and I'll allude to some of the work we're doing on permanency with respect to, can we predict for an individual client what their trajectory might be? And as a result, can we change the nature of the work that we're doing with that client in order to achieve a better outcome? So we came by the contract for Tampa in probably the worst way possible. There were 9 child homicides of children open to case management services in less than 3 years in that county alone. Probably an unprecedented national pattern. These were not investigations. These were not rollover fatalities, but these were, blunt force trauma type, abusive deaths. One child was thrown out of a window onto I-275. As a result of that horrific pattern of tragedies, the prior lead agency, which had the contract and up until that time had been very well regarded, was dismissed, and we were given a directive to change the way that we deployed resources, particularly around quality assurance, in 2 ways. It's probably no coincidence that the current Secretary of Florida, Mike Carroll, who previously had run quality assurance, when he saw the fatality after fatality, is really famous for saying, you know, I could write the reviews myself before I had even opened the file. The profiles of the children were all the same. Children who had young parents, were infants. There was a history of domestic violence and substance abuse. There was a paramour in the home. Very similar patterns. And the practice issues that were noted in all of the retrospective quality assurance reviews that have been done by the department and other entities really read the same. And the same practice issues were being repeated over and over and over again. And so what the department asked Eckerd to do was to deploy our QA resources prospectively. And instead of taking a retrospective review, instead say, okay, I'm going to apply those, and those QA folks are some of the most experienced practice folks in the field. I'm going to take that resource and I'm going to have them look at the cases that have the highest likelihood of a poor outcome before it happens and have them do the review then, so that hopefully the pattern and the trajectory can be changed. So before we began, we did a certain amount of due diligence. We looked at all the fatalities that had occurred. We reached out to the statewide death review team. We reviewed every single case that was open to the prior lead agency, which was actually more than 1,500 cases. And we narrowed the themes that we found into a very narrow tool. Typically, quality assurance is looking at a random sample, representative sample, and they're looking at hundreds of things. Tend to review 165 questions. We're actually on the Florida quality assurance tool. And what we found is that that wasn't working. The same issues were being found over and over and over again, and the assessment was right, but it was kind of like going to the doctor and getting the same x-ray over and over and over again and never putting a cast on the break. So instead what we decided to do was to narrow that list to just 9 things. And we also decided that we were going to review every child who was in home under the age of 3 against these 9 things. And we would also prioritize those reviews based upon some of those factors I just described. Young mothers, histories of substance and DV, abuse report received during services. And we data mined our SACWA system in order to find those kids and prioritize them for review. What we found in the QSI review is that safety plans were not tailored to individual cases and lacked family input. They were promissory in nature. I promised not to use drugs, etc. Background checks were not updated to reflect changes in family circumstances. Behavior change was poorly monitored with providers. We were accepting things like certificates of completion. Oh, they must be better now, not monitoring behavior change. And then, probably worst of all, supervisor reviews either failed to identify the issues or more likely repeated the prior concerns without resolution. And so we decided that we weren't going to just give this list of cases with the higher review to the front line, because what we found is that they've already formed a bias. Their supervisors probably already formed a bias as well about what should be happening on this individual case. Instead, what we're going to do is we're going to follow what Mike Carroll asked us to do, and we're going to have QA look at those cases with a fresh set of eyes and say, on these basic things to safety, are we taking the right steps in order to defend our practice if something goes wrong? And if that safety plan is promissory, how do we go ahead and make it non-promissory or get a monitor or whatever it is that we need to do in order to alter the trajectory? And so we did that, and when we find a problem, we have a staffing. It's a very peer-to-peer mentoring, coaching model in that staffing. And we ask the front line to come up with what it is that they want to do in order to rectify the problem. And then we track that to completion, because we didn't want to be a parallel process with a supervisor who was finding the problem but not fixing it. Okay? And so we track all those action items to completion. And then we review those cases until they're out of the highest risk cohort, typically when the child turns 3 or the case is closed. It also could be if the child is removed. So our results have been pretty promising, in particular regarding the practice issues, 53% improvement in sharing critical case information with stakeholders, 43% improvement in supervisory reviews, 33% improvement in safety planning, and 34% improvement in the frequency of child visits. This is 2 years worth of results over our baseline, which started in January of 2013. You can also see how, if you have a 53% improvement, how concerning your baseline data was. But that was the system that we inherited, and we think it's true of many systems around the country, that we have this level of practice concern, given turnover, given just the nature of the work, the lack of experience that so often is present. This was the results that we had, but we are pleased to see the results that we got as far as improvement over 2 years' time. Probably most importantly, we have not had any abuse-related deaths since the implementation of the program, and that will be almost 3 years. It's almost 3 years now. So a pretty significant difference. As a result of the promising, but it's certainly at this point unproven results, we have received a grant to share this work with 4 states. That's Maine, Connecticut, Oklahoma, and Alaska. And we also have recently been hired by Illinois to assist them in preventing a fatality or near fatality that has prior involvement. That is the key pain point that most public child welfare systems are interested in. It's much more difficult for them to prevent one where they've had no involvement. The data is much more scarce. So we are working with our partner, Mindshare Technology, to mine all of those SACWIS systems and come up with individualized predictions for the children who receive, in particular, abuse reports, and then apply the same QA approach, the same staffings and review processes by a second set of eyes in order to change the trajectory. Alaska is interested in preventing maltreatment regardless of findings, so not necessarily fatality, but just repeat maltreatment. They have a very high repeat maltreatment rate, so that's the particular pain point that they're interested in. Our work with them is a little bit delayed. We've had some difficulty in getting data from them out of their SACWIS system, although we're quite optimistic that when we do, it will be very robust and workable for us because we have the exact same SACWIS architecture in Florida as they do in Alaska. So once that occurs, we're very confident that the project will move forward very quickly. We think that we will actually launch the process in Oklahoma in December and hopefully follow up in early 2015 in Maine and Connecticut. I've alluded to the fact that obviously, because we've had a drop in deaths doesn't mean that we think this is necessarily causal. We certainly need additional research. We're working with Dr. Peter Pecora and Casey Family Programs to fund the multi-site evaluation using an interrupted time series design for all of the four states under the grant. So we'll be and we're working with them right now, planning that evaluation. I don't think that certainly this approach is limited to investigations or ongoing casework to prevent a fatality. It's in fact, it's probably even more powerful for permanency outcomes because you have so many more failures that you can analyze. We do pretty well on our federal outcomes in Tampa, but one of the ones that is just terrible for us is returns to care. So we've actually recently deployed a returns to care model based on the same approach, where we're identifying the children we think are likeliest to return to care. We have a post-placement 6-month supervision period in Florida, so we're taking a look at those cases at the time of reunification to see what it is that we can do to support the reunification and prevent a failure from coming back. We don't have a problem necessarily with timely permanency. We're pretty good at that. But certainly a model could be built around timely permanency for a jurisdiction that was concerned about who are the kids that are least likely to achieve permanency timely. Really what's absolutely necessary is just access to the SACWA system. To the extent your SACWA system has other linked data sets, that will only improve the prediction. But we have been able to come up with predictions that we're confident in based upon simply the data that's available in SACWA systems. Okay. And with that, I'll turn it over to Jennifer.
Thank you, and thank you for the invitation to be here. We're going to shift gears a little bit. I am with the university, but I'm clearly and definitely not part of the ivory tower. I just want to make that clear to everybody. I think in Matt's sort of diagram, I'm second down or maybe third, I don't know, but it's definitely not ivory tower, and neither are anyone that I work with that I'm going to be talking about today. So I want to switch gears a little bit and talk about our experience in Wisconsin, and I want to cover 4 things very quickly. It's this concept of integrating data, the what, why, and why not. Matt alluded to the possibilities of working across systems in this work, and that's what I want to talk about today. Talk about how we do it at the Institute for Research on Poverty in collaboration with our state partners. Give some examples where I'm not giving the results, but giving information about the questions that were asked and what was done with the results. And then top 3 key lessons. Each one of these bullet points could be an hour-long conversation on its own, so I'm going to speed fast. So hopefully not too fast. Okay, so integrating data, what do I mean by that? So when we're talking about this, we're talking about linking the routinely maintained administrative data across state agencies and also within programs, across programs within an agency. Because even if an agency houses all of the programs itself, it doesn't necessarily mean they talk to each other. So this is just the definition when I say integrated data that we're using. Why would you want to do this? Matt alluded to some of this, but multiple program participation is common for the families that we work with and for the child welfare involved families. If you can link data across programs, you can look at a view sort of upstream before these children ever hit the SACWA system, if they were involved in other programs. You can also look at variation across individuals and across time. One of the things that we have found is if you break down data silos across programs and agencies, it can also facilitate collaboration across those programs and agencies. Once they realize that they share families and they share those common interests, then that actually leads to a conversation, and sometimes data can be the leverage point to do that. Also, sometimes information in one system can be very valuable to another system. So, for example, non-custodial parent contact information in a child support system could be very helpful to people working in the child welfare world. So great, this is great, so why not? Why don't we do this? This slide can be summarized and it can be really, really hard. So this administrative data, that's an understatement. Administrative data is not designed necessarily for this purpose. In particular, there's not one requirement that everyone maintains a single way to identify so that you can link across all the systems. Even when you do go to match, there's not necessarily agreement upon what variables that you should match on. If you're working across agencies with different missions, sometimes the hierarchy of what they think is important in their data will differ, and sometimes you have to override data in someone's system to make a match happen, and people don't want to give up the control of their data that way. And the other thing is data sets, as we all know, they change over time. Coding changes, what things mean change, and historical records aren't always maintained. So these are just a few of the highlights about why not, but I think, like I said, I think I could have just put it's hard and moved on. So having said that, what have we done in Wisconsin with the Institute for Research on Poverty and our state agency partners? So first of all, for those of you who don't know what IRP is, we were created approximately 50 years ago, so 50 years ago next year, as part of the War on Poverty to support basic training, research, and evaluation around anti-poverty policy. We are one of 3 poverty research institutes in the country. We receive core funding from the U.S. Department of Health and Human Services. We also receive some funding from UW-Madison itself, but the vast majority of our work is funded through grants and contracts with a variety of entities, state and federal agencies, foundations, and the funding comes in to look at specific questions or problems. We have researchers like myself The core of the work is actually done, there's very few people like me. We have faculty affiliates both on campus and around the country who work on the research questions. And so that's the resources that we bring to bear on questions. One of the great things that we have is we have specialized programmers who actually have very deep knowledge and expertise about Wisconsin administrative data. And this is a resource that without which we cannot do the work that we do, to the point of we actually have some of our researchers who work on the programming will embed themselves within agencies. We have one who actually has a desk in one of the agencies, to work collaboratively to make sure we understand the data that we work with. One of the primary things that we do is we make sure that we are not just taking the data and thinking it means what it looks like on paper. We make sure we understand what actually the elements mean. So this staff is really critical to our success. So what is the IRP data core? So I'm going to call our integrated data work the data core, just for shorthand. So where we are today evolved from a series of large-scale evaluations that we conducted in conjunction with the state of Wisconsin. One of the key ones was the child support demonstration evaluation that was done. It's not like we woke up one morning and said, let's pull this data together and make it work. That wouldn't have been possible. This has been an iterative process over time. The funding largely has come through these state contracts and federal contracts to do work around specific issues. And we build as we go along, pulling in different systems. So if a research question requires a set of data and we can bring it in and get to know it, then we like to be able to continue to use it going forward. One of the caveats that I want to put in here in contrast to what we just heard is that what we do in terms of matching data and working with data, because we use probabilistic matching, it's not intended to be used for legal purposes, and it wouldn't be like a caseworker couldn't do a lookup on someone to see how they were involved. It's also not in real time. We do update the data very frequently, but it wouldn't be today, like if you were to key in something. The one thing that it definitely does is it complements the agency efforts, kind of like what we just heard in the previous presentation, but things like our Department of Children and Families has something called KidStat, where they go through and they do data mining, and then we will be there to maybe provide a broader view or to investigate data if they have questions about a direction that they might want to go. And that's really key. One of the really key things to what we do is this logic of collaboration. You'll notice there's not a one-way arrow on this slide. That's because we at IRP very much need and like to and value our collaboration with our state agency partners, and I think vice versa. So everything that we do, we try to ensure, and actually we must ensure, that somehow the research that is getting done can feed back into the program and policy who's providing us the data in order to help them with their administration of the program or improve their outcomes. And in turn, as the value of that information is demonstrated to the Wisconsin state agencies, and they support us for pursuing additional questions, and then ultimately for those for whom it's really important to get their research published. And this circle becomes even more dynamic. Like I said, the higher the utility of what we do, the more information the state agencies want, and the more we do, and it just keeps gathering steam, I guess. So maybe it should be twirling, I don't know. So here is the list of the current data with which we work. So you can see, we just talked about the use of WSACWIS data. That's third from the bottom on the core list, which is the left-hand side. And then these are all the other sources. So you can see I'm not going to read the program, the programs you can see. And then in parentheses are the state systems from which it comes. So Child Protective Services, WSACWIS. So this is all the data that we are currently able to work with, basically from the beginning of the program. And what we will do with the data is we can either do like specialized matches within different populations, or the main way that we're using the information now is in this what we call the creation of a multi-sample person file, or MSPF. And the basic structure here is one record per individual, without distinction if they're an adult or a child, or male or female, but one person over time across programs. This requires the matching and merging across all the data systems that are on the left-hand side of that list, because the other ones are specialized matches, using a combination of different traits and different variables. We have a technical report that's been written on this that we're happy to share. Very complicated. I'm not a programmer. I know it's complex and time-consuming and expensive to do. And again, just a reminder that when we do this matching, because we use probabilistic matching, it's for research purposes. Okay, so now I just want to give some examples just by the types of questions that we're able to ask and answer because of this data set that we have. And before I do, back when I talked about, skimmed over sort of the structure of what IRP is and our collaboration, all the work that I'm presenting involved many, many different people, faculty, staff, doctoral students, people within the agencies, and many funders who I can't acknowledge right now, but just know a lot of people contributed to all of this. So the first example that I want to give is basically a counting example. This work was born out of work that was driven by a question about disconnection from public programs. In order to talk about disconnection from public programs, you need to talk about connection to public programs. And so I picked out just one question out of 20 different ways that we cut the information for the state around the proportion of mothers with children reported to the child welfare system who are participating in other programs, either in the year before screened and call or a year after screened and call. Okay, so this was a question of interest to our Wisconsin Department of Children and Families. So this is just graphically, the representation of that information. The middle 4 bars are Department of Children and Families programs. The 2 left-hand bars are Department of Health Services. The 2 right-hand bars are Department of Workforce Development. And it's because we can do this integrated data that we're able to pull this information together. So that's before screened and call, and that's after screened and call. Where the solid blue is the continuing families, and the hash marked is the new families. I'm not going to interpret this or anything today. I'm just showing you what can be done with the data. Okay, so now I'm going to move to some examples that cut across some state agencies. These are different questions that have been asked around the relationship between child welfare and incarceration. We're actually kind of at the beginning of this work, pulling in our Department of Corrections. But these 3 questions: what proportion of child welfare involved children have an incarcerated parent? What proportion of children who were involved were subsequently incarcerated? Of all the adults in prison, how many were child welfare involved as children? Those are all questions that came out of our Wisconsin Department of Children and Families, but are now of great interest to our Department of Corrections. We actually have, this is a describing project, and we presented just last week did a briefing just last week to our Secretary of Department of Children and Families and our Secretary of Department of Corrections together with their senior staff, the information around this. And has generated a lot of conversation about what does this actually mean, what should we be doing to going forward with this data in order to better inform serving both populations. So how do we, if we can do predictive analytics around kids who are already in care to keep them out of prison, or to deal, you can think of 100 different ways you could start to use this data. They are thinking of 100 different ways of how to use this data, and I'm trying to figure out how we're going to get the work done. Here's another example around the relationship between child welfare and education. This moves from counting to analysis, and this question came out of a collaboration between our Department of Children and Families and our Department of Public Instruction. And they had a federal grant to look at ways to improve the relationship between the 2 systems and how education and child welfare go together. And these are the questions that were asked, and it's essentially whether or not, per se, being involved in the out-of-home placement has an effect on your educational outcomes. We are actually moving now into the 3rd question about the relative strength of the relationship between school quality versus stability. We're now working with school quality information from our Department of Public Instruction, as well as, if it matters, what kind of placement you have. The way that we share this information is, well, I should have backed up. When I said before that, like that circle where we're all, there's something in it for everybody to get this done. So that last set of information that we're working on for the faculty that are involved and for the researchers that are involved will actually be published in Annals, in an upcoming issue of Annals. This work was published in Pediatrics. And it also has been the subject of several different papers that we've written for the state, several briefings, We just put out these 2-page policy, briefs to get all the information out there. And the way that the second set of analysis was developed was through conversations. Once we did the first set, we all sit down together and we figure out what's the next most interesting set of questions that we can work on. The third set of examples relates to the interrelationship between child welfare and child support. What is the effect of child support income on the risk of maltreatment? How often are parents charged with child support to offset costs of out-of-home care? How often do they pay? And do these orders offset costs or delay reunification, or do they motivate change by the parents to promote reunification? This set of questions actually was developed from a set of researchers at IRP based on their prior work. And then once they went and talked to the agency about it, and this is a within Department of Children and Families set of questions, they completely understood why this information would be important to know. The results of this information has been published or will be published, and we have done many, many briefings around this and have been involved in a task group, I guess would be the right word for it, out of the Department of Children and Families, where they're taking the results and they're actually modifying policy around the referral of parents whose children are out of home care to have a child support order put in place. So each of these examples, were driven either from the departments or from the researchers, but we've always worked together collaboratively, and then we spent a significant amount of time reviewing the information with them and then talking about its implications going forward. And then, like I said, every single one of these has resulted in a much more expanded sort of research agenda, going forward. So some of the key lessons, as I'm like shooting on a bullet train through all of this, I don't know how much I can emphasize this and the importance of it, is this collaboration that we have with the state agencies is absolutely critical and essential. A couple weeks ago, I was at a different forum where I basically said, the fact of the matter is, if the arrow that I had in that one diagram was one way, with researchers just taking the information and running off and doing a bunch of interesting questions, but it didn't mean anything to anybody, this would never work and it wouldn't have any relevance, right? So we invest a whole lot of time in relationships. We invest a whole lot of time in understanding the data. We never presume that we get what a data element, is. When we spend a whole lot of time making sure that when we get the results, that it makes sense to the people in the field. And that means not just people like in the state department levels, but we try to go out and talk to all the counties. Does this make sense to you? What does this mean in terms of your reality? The examples I just touched on today, they cross the Departments of Children and Families, Corrections, Health Services, Public Instruction, Workforce Development. It's this broad array of individuals. And I would say, way back when I said using integrated data can help break down program silos, the fact that we had that meeting last week, with 2 secretaries briefing them at the same time instead of 2 times separately, was worth the price of admission of all the challenges we had trying to get that data done. Because when you start to have those cross-program conversations, not just the cross-data conversations, all of a sudden you can see that change can happen. And it's great, and I can't say enough for our state agency partners, because we're all in this together, and we couldn't do what we do without them, and hopefully we're helping them too. One of the second lesson that I just wanted to say was an involvement like an entity like ourselves. We are actually a state agency, but we own none of these programs. We own none of this data. This data is still owned by all of the agencies that we work with. But because we don't own it, and because we don't have any biases towards which program is better than the other program or that type of a thing, we can be arbiters of how to go about matching, particularly the probabilistic matching. So I didn't talk at all about our experience working with the court system here, but we are involved in a project that is looking at the timeliness of hearings for child welfare cases. And initially, they tried to do the data match across our court system and our Department of Children and Families. And because of the requirements of matching out of the court system, they got like an 18% match. And that was because if they were to match me, and the court system had Jennifer with 2 ends, and WSACWIS had Jennifer with 3 ends, it couldn't match. Well, we match it. So we're able to get a 97% match rate when they had, whatever I said, 17, 19%. And that's good enough for what they're trying to do for measuring timeliness. It doesn't have to be they would never use it for a legal reason, but it's good enough for timeliness. And the last point is the infrastructure to do all this. It really takes commitment on the part of all parties. This collaboration that we have, it spans time and administration, and it has to do with building up goodwill, and it's not necessarily relationship dependent as a person, but as organizations, and building trust. So when I talk about sustained commitment, I'm just not talking about sustained money commitment, which would be really nice if we could get like a sustained funding stream, but there's a sustained commitment organizationally, to make this work. And particularly, I think incumbent on researchers not to sabotage that relationship by trying to make that arrow be one way. It can't be one way, it has to be circular. So that is it for me, and I'll turn it over to Maria.
Well, good afternoon, and thanks to Mathematica and everybody who's here. It's a little hard of an act to follow, but I think what's clear from both Brian and Jennifer's comments, and also from the introduction that we had, is how important, what the potential for moving this effort forward is. What I'd like to try to do is talk a little bit about why there is such strong support for the general effort of interoperability and program integration in the administration, particularly in HHS and some of the work that we're doing in ACF. Because I think what Jennifer said is really right. This is really hard work. It requires a sustained effort. It requires us to understand the potential, but then also to be willing to do the kind of institutional work that's necessary to sustain it. A lot of my interest in my current position is in the ways in which integrating systems and sharing data can be supportive of kind of frontline casework and performance management. I don't think that it is distinct from, but very complementary with the work that can be supported with research that might be a little bit more general. I won't say higher level or lower level, I'll just say more general. And I will say, and I don't want to be biased, but I do very much like this, the very fundamental recognition of the iterative process. And I think that it's iterative in many ways, but part of what is very challenging about this work is that it does require real investment, and we need to be making some progress in order to understand why it's worth making more progress. So I'll try to talk a little bit about that today. So in general, why interoperable systems? Why would we do this? Why are we so focused on interoperability right now? I think it's because we understand that interoperable systems are key building blocks for coordinated family-centered services. And I don't say family-centered in just kind of because it sounds nice, but really it's very different to think about a problem and a solution from the perspective of the families that you're serving. And one of the things that I have never met, actually, is a family that identifies themselves as a TANF family, or a child support family, or a child welfare family. We have families who have strengths and challenges, and they are being, I hope, served by the programs that we have, including the ones in ACF, like child welfare and TANF and child support and Head Start and child care. But our programs need to meet and help move forward those families where they are as a family. And when we can only see those families as program administrators or as frontline workers through the narrow lens of our program, sometimes because of regulations that the feds, that my agency has put forward about what you can see about other programs, that does a tremendous disservice to the people that we're trying to serve and actually to our work. So why now for this? I think there's a couple of reasons why this is a particularly important time to be moving this agenda forward, and I think a promising time. So one is, I think much of the country is focused on the healthcare system and the costs of healthcare for a variety of reasons. And with that has come a real recognition of the social determinants of health. The fact that if we can provide healthcare to a child in a family, but that child is going home to a situation that isn't generally supportive of health, that is not going to solve the problem. So we have much more of a focus of social determinants, and that requires immediately integrated systems, and it requires observing and thinking about the challenges and resources available to families and children over time and across systems. And so that's something that's bringing this to the front of the agenda and helping us understand the value of these investments. The other is just that we're in a time of tight budgets and a time where we need to make really good decisions about trade-offs, about difficult trade-offs about where to spend our resources. I think that's always been true. I first met Jennifer when she was an administrator in the Department of Workforce Development, I think it was called at that time. And I was talking about why something was a good thing. And she basically said, yes, but is it a better thing? You know, like if I only have $1 to spend, where should I spend it? And that is more true now than ever. And that requires us to be able to think about the value of investments at different times in the trajectory of a family and across different systems. And it's just not good enough to be able to understand things in those siloed ways. Third, we have a real increased demand for transparency and accountability, not just with respect to inputs, not just what have I done and what did I spend and what did I provide, but what were the outcomes, maybe not the impacts. We aren't always in a position in the technical sense to measure impacts, but at least what are the outcomes that I'm seeing? And outcomes often are not measured in that same system. Okay, so if I'm providing Head Start, and that might reduce the probability that that family will end up in the child welfare system, that's going to be an outcome that's in a different system. It's that same child at a different time in a different system. I need to be able to make those connections to understand. And if that's true for some families or families in some Head Start programs and less true for other families or other programs, I need to be able to make that distinction because it's not enough to know that something's good. I need to know where is it most important to make that investment. And finally, this is not an easy time to get things done in DC for lots of reasons. There are a lot of challenges. My experience is actually child welfare is a place where there is a lot of bipartisan support for moving things forward for families. So in the child welfare area in particular, but more generally, I think improved data and information systems and integrated systems and the ability to track both inputs and outcomes is something that appeals broadly. It may be because you are very concerned about waste, fraud, and abuse. It may be because you want to make sure that families receive an integrated set of benefits that reflects what they really are entitled to and need. Those are both served by this kind of a system. I actually think those are not opposed, but actually complementary goals. But in any case, there's broad support, I think, from a lot of different places for being able to account for what we're doing. And so I think for all those reasons, this is a particularly good time to be moving forward. So if it's a good idea, what is ACF doing to try to move it forward? A couple of things. I won't spend too much time on this, but many folks, especially in the States, are aware of the A87 waiver of the waiver of the OMB 87 cost allocation, which allows 90/10 funding that is available for improving Medicaid, ACA systems to be used for elements of systems that also support other programs without cost allocation. And that waiver has been extended through the end of 2018. And it creates a real and very special opportunity to move forward with integrated administrative data systems, which aren't necessary to the kind of work that Jennifer talked about, because part of what she's doing is compensating for the lack of integration across systems. But in a fully integrated system, you wouldn't need necessarily to match across all those systems in all of that expensive and cumbersome way, because you would have ideally the kind of record management and other things that would allow you to follow people over time and across programs in real time. So that's, we've been working with our state partners to try to move forward on that, including providing some technical assistance and a collaborative site for program administrators, and there's more information on the ACF website on that. We've also been renewing and kind of reinforcing the ACF interoperability support. We have some new staff that are working on data sharing and data interoperability, and working on new technical assistance and guidance to help our state partners understand to support state efforts to share data in appropriate ways, providing additional guidance, and also some work on systems design. And I should say in this work that we are collaborating very closely with CMS and FNS. This is part of, I think, a broad effort in the federal government to try to think about what we can do to better support the best use of resources, to protect privacy and confidentiality, and at the same time to be responsible with respect to both taxpayers and the clients that we serve, to not hide behind privacy and confidentiality as an excuse for not being accountable for the work that we do. So in particular, just a few things, since the focus today is on child welfare. I wanted to highlight that in 2016, we do expect to issue new regs with respect to AFGARS, which is the data system for foster care, and also that we have new comprehensive child welfare information system. And one of the things in this context that's particularly notable about the CIRE system is that it includes requirements for better connections between the child welfare system and other systems, including courts. And so it's designed kind of fundamentally. I think it's a nice example of what we're trying to do to try to help encourage states to build systems that fundamentally are designed for information sharing, recognizing that each of these systems has to work with other systems. And we've been doing a number of other IMs and other things to try to support that. And given the short time, I'll skip that. So I'd just like to close with a couple of points about why I think linking and sharing data is especially important for child welfare. And I hope this will tie together some of the comments that were made earlier. So families served by child welfare have typically been touched by many, many systems over time. So on the upstream issue, we would prefer in some ways not to have a child welfare system, in the sense that we would like to be in a world where no family required it. That's not likely to ever be the case. But Jennifer showed a slide of all the systems that families that were eventually screened in, I think it was, for child welfare had been in the year prior to them being identified. And you saw things like, I think 2/3 were in SNAP, a number of other programs. And the question is, what can we do, whether it's with probabilistic matching, whether it's with other programs, to recognize families that are at risk of needing more support and to target resources? Because we are in an environment where we cannot provide all the supportive resources that one might like. But as is emphasized in the President's budget proposal, prevention is really a critical part of child welfare. And we really would like to be able to use these data to inform the best use of resources to help children and families before they require child welfare intervention. When families are being served by the child welfare system and all these other systems, it is absolutely essential to the benefit of those families and for good use of taxpayer resources that we be doing that in a coordinated way. And that we find ways to allow frontline workers to have appropriate access to information. I think people would be surprised to know how much we don't let the left hand know what the right hand is doing, and how difficult we make it, unintentionally, but how difficult we make it for caseworkers to do their jobs appropriately by not allowing them to know what is happening in other systems. And finally, if we're going to know what we've done well, if we're going to make a case for the value of our systems, we need to be able to measure outcomes that are outside of the child welfare system or outside of the system where we're making the investments and that happen after child welfare involvement. So we need, or for example, I like to use the example of Head Start and child welfare because both Head Start and the child welfare system are within the Administration for Children and Families, but I cannot tell you, I don't have access to data from ACF's perspective to tell you whether there's any relationship between Head Start participation and two families who appear at the time of initial participation to be similar and the risk of child welfare involvement 5 years down the line. I could have a hypothesis about that. Both of those programs are funded and administered through ACF, but I can't tell you that answer, so I can't make that case. And as somebody with related responsibilities, if that case can be made, I want to be making it. And if that case can't be made, I want to understand why. And if it can be made in some cases and not others, I want to be redirecting investments appropriately. So from any perspective, it is absolutely essential that we know the answer to those questions. And we need to be building administrative data systems with a mind to doing that. So I'll just close by saying, one of the things that I think about when I think about data systems, because I've spent more and more time in meetings about IT builds than I ever thought I would, I said to somebody, if I was talking to a program administrator who said, this data sharing, this is fine, but my responsibility is this particular program, and this is something else, and don't talk to me about this. And I said, okay, well, how about this? What if you were talking to somebody about a system and you raised data security, and they said, data security, that's not my problem. Well, you'd be outraged, right? I mean, nobody can talk about a data system they're building for any given program and not explain how they're going to maintain the confidentiality and security of those data, right? That's fundamental to everything we do, no matter what program you work in. We should feel the same way about data sharing. When you're creating a system to manage the administration of your program, those data are fundamental to running your program and to integrating your program and serving those families vis-a-vis other programs. And it should be as unacceptable to say, I'm not thinking about whether my system can talk to another system that this family, that is served by this, that serves this family, as it is to say, I'm not worried about security, that's not about my program. So, with that, I'll turn it over to Matt.
Thank you. Thank you so much to all three of our presenters. So we will turn for the last 28 minutes or so to questions and answers. I thought I might ask a question to get the panel warmed up and to give those of you on the web as well as in the room to think about questions that you might want to ask. So my first question would be for Jennifer and Brian, just as we think of this continuum of use, to think about the similarities and differences between the two uses that you've given and help the audience think about how what you're doing has a lot of similarities but also a couple of differences, and highlight those if you could. I don't know which of you might like to go first. You're arguing about it.
You're arguing who wants to go first. So I think there's similarities in terms of the goal around. So I think with SACWIS, trying to understand based from past experience how to predict what might be coming down the line in terms of challenging cases. We're going from outside of SACWIS across multiple programs, and I think one of our strong goals would be actually to be able to use the data that we have to maybe do some of the sort of predictive things that you are doing, much as Maria alluded to. If we could figure out a way to use the data that we have available to determine whether or not involvement in the where to put those resources to avoid a problem down the road, sort of upstream. They're upstream questions, right? And so I think there's a lot of similarities in that way. We are working at a level above what a caseworker needs right in front of them and at that moment, where we are right now, but maybe in the future, if you can look at predictors based on previous program involvement, that it might be very useful to a caseworker.
I was struck by the similarity in the challenge. One of your challenges was data sets changing over time, and historical records of these changes need to be maintained. In our experience, that does not happen. Actually, and also relatedly, the size and number of the variables that you're looking at can be a nice antidote to that, because what our data partner Mindshare will say is that they're not looking at 5 years ago data, 4 years ago data. It does not bear the same relationship to the current day because precisely of that issue. So instead, what they would rather do, they would say they'd rather go wide than go deep. They'd rather have a very significant number of variables that are very proximate in time, rather than 6 years of historical data of the same variables over and over and over again, because the changes are so significant with model changes, practice changes, data entry changes. So that's how we've been dealing with that problem, but if we were to have the same width, it would only improve the work that we're doing so significantly.
Great. I'd like to go first to the web, I think, if there are questions coming in. So Steve will read the question and let us know if it's directed to a certain panelist, and if not, we'll again arm wrestle over who has to go for it.
So Stephen Cook asks if there are advantages to having data integration efforts housed outside of program agencies, such as IRP.
So I say yes. Now, having said that, so I said that in my presentation. I think the primary advantage that an outside agency has that doesn't own the data itself is the ability to make the decisions about. For those people who work in programs, within your program you have to privilege a certain kind of data that's important for your program. So there's almost like a data typology within different programs that certain fields mean more than others, and sometimes information is collected that doesn't have as much meaning to the running of that program. And so child welfare needs a certain set of information that maybe TANF doesn't, or SNAP needs a certain set of information around income eligibility that child welfare doesn't. And so an outside entity that doesn't own any of that data can help arbitrate that sort of decision making and hierarchy. Having said that, if there was a way, as Maria had said, for some system outside of us to have done all the work to make it all talk to each other, we would happily take an abstract, to answer some of the questions. So to me, the primary advantage is to be able to be that glue across the agencies. And also in that diagram with the circle, one of the things that it noted that we have as an advantage is a longer time horizon and the space to do this. As I said, we often think about the amount of money it takes to actually make the systems work together, but it takes a lot of time and energy to pull all this together, and an outside entity that doesn't have to have the day in, day out responsibility for making the program work and avoid the child deaths and all that can have the space to get it done. So I think that's definitely an advantage.
Maria, did you want to weigh in on that?
Well, I just would add that, I think there are, so I have a conflict of interest, so I won't speak to the advantages of an entity like IRP being involved in the way that Jennifer said. But I will say that I think there's an underlying point here that is really important, whether you're talking about an institution that does the work or whether you're talking about some of the cross-systems work that's being done across public agencies, which is that we often have focused on the technical difficulties of integrating data systems, and I really believe that governance and legal issues are fundamentally more important. And maybe that's just that the technical has caught up with us. But I think one of the problems that we tend to focus too much on is, what we need to build in the computer system. We have a lot of ways of getting around that, whether it's a new system, whether it's using data standards or NEAM or something else to connect existing systems. We've got lots of ways. But the things that we really are challenged by is kind of legal issues around data sharing and confidentiality and privacy, which are really critical, difficult issues around which there are not right answers, but they have to be negotiated. And then what I would call data governance, which is the very hard, sustained work that needs to be done across agencies around, my agency will share data with Jennifer's agency, but which data elements will I share, under what conditions, when is that appropriate? what kind of reciprocity is there? How are we going to be assured of using things appropriately? So I think those are real challenges. And there's ways, we have models. There are jurisdictions that have made real progress on that. And one of the things that we're really trying to focus on at ACF is to help provide some technical assistance to help elevate best practices and help our state and local partners know kind of what is permissible and some of the ways to do it. But again, I would emphasize, that kind of circular back and forth that Jennifer outlined between state and university could also be between states or among state agencies. It really is a question of sorting out how we're going to help one another. And one of the things we've said, even across agencies within HHS, is getting away from getting to a yes and less place, getting to a place where we are willing to share information unless there is a compelling reason not to, as opposed to a place where we won't share information if there's any reason not to. Because there is a reason not to, always. There is. The problem is that there are downsides as well, risks to our systems and most fundamentally to the families that we serve if we are reluctant to either take the risk or do the hard work that's necessary to responsibly share the information that we need to in order to provide the services that we need to be able to provide to families. And that's really, I think, what has to drive the effort. What really has to drive the effort is a sense of the families that we're serving, the children that we're serving, and what information needs to be available to caseworkers in making decisions about a child's life at that moment, and what kind of information needs to be available to program administrators and policymakers in order for them to make wise judgments about investments of resources. Because those are very challenging decisions, and they should not be made in the absence of information that could be made available through these systems.
Great. Brian, did you want to weigh in on that or not?
Everything she said. In particular, the data sharing struggle is, the struggle is real. We have been through that. We understand why that is, for all of the very important reasons that are there. But at the end of the day, it's incumbent upon us to, we've spent so much time, money, energy, treasure, putting all this data into the SACWA systems and into all these other systems. It is a crime not to use it. So,
good questions in the room. Yes, if you could say, wait 1 second for a microphone and then introduce yourself, that would be great.
Hi, I'm Stephanie Shipman with GAO. And having worked in some of the social service agencies, the Institute for Research of Poverty and University of Wisconsin were working together on research and using data services like 30 years ago. Other states are not or have not. So what's being done to move beyond the maybe 5 states I can think of who historically have either a strong governor's office, right, or a strong connection with a university like that?
Great question. The first step, of course, is a Mathematica forum. Maria, do you want to say something, or
so I can say that there's a lot of awareness at the federal level, both in the administrative branch and I think quite a bit of interest on the Hill, and you would know from your vantage point in trying to move this effort forward. We'll have to see how far we get, but it's certainly on the agenda.
And Jennifer, I think you get lots of inquiries from. There definitely is a growing community. Yeah. It's not anymore 5 states or localities.
I think there's definitely a growing community, and a lot of it is being driven by homegrown type of interests, like what the story that we have out of Florida that is now going, national with the work that you're doing. There's a lot of information sharing that goes sort of state to state. There's a lot happening on the local level within different jurisdictions. I get calls a lot about sort of our experience and what we have done. But I think Maria's talking about the growing awareness and support federally for sure, and it's definitely happening across the country in many, many places. There's lots of different ways to do this. And the model that we have is just one. And it, like I said, it has grown over time and is built on a foundation of many, many years. But it doesn't have to be the way that we do it. And there's a lot of models that are out there that are growing.
Great. Steve, do you have another question coming from
panel? Mithuna Srinivasan from Impact International would like the panel to speak about the importance of integrated data in the context of two-generation approaches.
Great. That's a very good and timely question. I'm not sure which of our panel members would want to speak to that.
So I'll jump in.
Okay.
So I think it's a really good question, and
Can you describe what a two-generation approach is, as
Well,
you understand it?
So I think that we've been doing two-generation approaches for a long time, and that it's just a label that we're using now where we talk about engaging the parent and the child sort of simultaneously. If one wants to think about two-generation approaches over time, integrated data actually, the way that I was talking about it, allows for you to trace the experience of the parents at the same time as the children, and you can watch what's happening and develop programming across systems. So if you want, a two-generational program might be engaging low-income parents in some kind of a job training program with some assistance at the same time as engaging their child in a Head Start or in a pre-K program or something like that. Without integrated data, unless you set up a specialized system, it's what Maria was saying before, the Head Start child welfare relationship, right? You can't follow what's happening with that family over time. And so like with a system that we have, our MSPF system, because we can follow individuals, but those individuals, we have parent-child files where the individual child to the mom, to the dad, maybe the dad to their kids with a different mom, those types of things across the programs. Then you can measure the effect of what would be called a two-generation program that's trying to deal with both parts of the family at once, instead of the child in Head Start over here and maybe the mom and TANF over here, or maybe the dad and some kind of a fathering program over here. If you have the integrated data, you can look at them all at once without a special build around that program. So.
And I would just add to that I think part of the logic to a two-generation approach is this idea that some of the returns on the investment for, providing employment to a mom or providing childcare to that those investments have returns across generations. And again, that goes to this idea that we cannot really understand what the value of our work is and where we're getting the most value for scarce resources unless we can see across, unless we can understand the family as a whole, unless we can see across programs and over time.
Just one example that goes to that, I was talking about that relationship between child welfare and the Department of Corrections. So one of the questions that came out of the work that we were doing is, of the children who are in the child welfare system now who have parents in prison, how many of those parents who are in prison were in child welfare themselves as children? So we can do that because they're trying to think about the interventions, not only when those parents come back into the community, but also then what does that mean for those children who are engaged in the child welfare system right now? So it's two generations over time, but then you would develop a two-generation approach from that information.
Right. That's an excellent value of the long-term investment, such as that IRP has made. Back to the
I'll just chime in. I think in child welfare, our blind spot tends to be with information on the parents. We have, very granular information regarding the children that we're serving, from medical information. We actually have educational data feeds from our school systems, but we do often lack some of the other data sets that would be so valuable and improve the other half of the equation with the families that we're serving. So to the extent that that can be available, it can only improve the work that we do.
And that seems especially important to the permanency issues that you raise, that unless we understand the condition of a family while a child is out of care, how are we informing the decisions about when that child might return home? So. Good. Back to the room. Question in the back. And again, please introduce yourself if you can.
stand up. Hi, my name is Claire Smither-Wilson. I'm a research analyst here at Mathematica. And my question is for Brian first, but everyone is welcome to chime in. When you were describing the turnover that your program did in Florida, I was curious if you could talk a little bit about, did you all keep the frontline staff and the supervisors, and how much buy-in did you have to give to them on this new data-centered approach?
I was shocked at the level of buy-in that came from the front line. I think partly that just came from the situation and the system of care that folks were living with, and the reality that everyone wanted to turn the page. But the other part of it is that folks on the front line are pretty sick of hearing from QA after something goes wrong and they tell them everything that they could have done differently. They are much more interested in having the partner of QA tell them what they can do differently now, and have them, in some cases, sign off saying, actually, what you're doing is great. And that is a paradigm shift for the relationship between quality and the front line. The other thing that was particularly significant is that sample size I was speaking about. So, we're reviewing, a couple hundred cases a quarter instead of 30. So the coaching opportunities go from 30 to 200. And so instead of talking to a worker maybe once a year, if that, we're having continuous conversations and a relationship that's formed between those comparatively experienced quality assurance folks and the front line and their supervisors. And it's designed in such a way so that we're trying to build their competencies, and so we really we don't call and say, hey, we think there's a safety problem with your case. We call and say, hey, we've got some questions, and we just try and use that to get them to see it our way, or tell us why we're wrong. They're the experts on the family, having been in the house, and so we just try and meet them with, we may have a little more experience here, but you have more experience with the family, and come up with a joint solution. So it's really been, as the QA guy, you're used to walking down the hall and hearing the door slam before you get there. And it's really not that way. One final thing is, a lot of staffings in child welfare tend to be dependent upon, the biggest personality in the room and the way the case is presented in the first case. We read the case on our own. There's no case presentation. We just call them and have a few questions about their case. It's a very different situation. We've already formed our own opinion, and we don't need them to regurgitate everything they've already read to us. What we need them to do is fill in the gaps and help us understand if there's anything else that's missing, and us to maybe get them to see maybe there's something else we need to do. So it's a partnership experience, and I think for that reason is why we've had the buy-in that we've had, which has been tremendous.
It sounds like the data help take some of the defensiveness out of that as well, that the data are the data. You put them in front of people, and that's a shared knowledge base that you can then discuss around.
Right, it doesn't feel arbitrary and capricious. This case is being reviewed because it is one that we think that there's a high probability of a poor outcome. So it's nothing you did. It's the facts of the case that brought it to the fore. Interestingly, when I say it's nothing you did, that isn't absolutely necessarily true. One of the things we find is that system variables matter a lot, and more so in some cases than you would think, and more so in some cases than demographic variables or the reason the child came into care. One of the things that's been surprising in returns to care prediction is the importance of the number of caseworkers for a family. Certainly we would have thought in a permanency prediction that would have been at the top of the list, but on a return to care, sure, did it matter? Yeah, but would we have thought that much? So sometimes when we remove our own bias and it's just the data being the data to the point, it can be revelatory for people who think they know more than they might, including all of us. So,
good. I think we have time for one quick question, probably just to one panelist. So,
okay.
Steve?
Not sure to whom this is directed, but it's from Lisa Vogel, and she asks, to what extent are nonprofit community organizations tied into administrative data systems? Do you see a need to do more to link with data from these types of providers?
Great. So, Jennifer, do you want to take that? Brian?
Well, I mean, of course, we are a nonprofit provider. But I think what it speaks to is actually the issue of that I was just alluding to is how much information do we have on for example, the parents or the services that they are receiving, and to what extent is that information automated, robust, and to the extent it can be, it's absolutely critical. In a previous role, I designed a system that would automatically track what happened on an investigator's referral. And because there's this tremendous game of horrible phone tag and fax tag and email tag that is played every day across this country with frontline workers and the people providing services to families, trying to connect around exactly, what is behind this certificate of completion that I alluded to earlier. And so to the extent that that data can be automatically delivered, you can really, I think, change the face of the quality of services that people get.
I would just flag that Brian's comment about privatization, many other states are privatized to some extent in that they have private providers providing under contract to a state or county agency a lot of services. So I think this question goes to the need that those things which are slightly outside the purview, the immediate purview of the state agency or county agency, the more those can be tied in and the more data access can be given to those providers when possible, the more they can do the kind of work that you're talking about. So thank you guys for your presentations as well as your Q&A, and I'm going to turn it back to Anne.
Thank you. Well, I just want to thank everyone for coming, especially our panelists. Thank you for your time and energy that you've brought. Apologies if we didn't get to your questions. For those of you who are here in the DC office, we invite you to join us for the reception afterward in the lobby. And you can potentially ask the panelists your questions in person there. Also, I would invite you, those of you on the webinar, if you have follow-up questions, to reach out to us at CIRE. We can field your questions as best possible, including sending them on to the panelists if that's required. Thank you again. Please be sure in your packets, and those of you on the webinar also have a link to let us know how you think we did by filling out our survey. So with that, we'll end the forum. Thank you all once again.